Now I have a very exciting woman who's a Harvard Medical School doctor, and she has switched up her life because she believes that cannabis is the answer to a lot of medical problems and a lot of cures, and we need to focus more on that. So I would like you to give a warm welcome to Dr. Uma, who's here to talk to us about breakthrough technology and science with cannabis. Come. Thank you, thank you. Mwah.
And so to see my mother that was dying of an illness known as idiopathic pulmonary fibrosis, fancy term for we don't know what caused your lung disease. My mom had never smoked. She had never ate red meats. She exercised, she maintained her weight, and she did all the right things. She had thyroid problems, she had diabetes, she had cholesterol, she had Lyme's disease, and then what killed her was idiopathic pulmonary fibrosis. I never got to use this medicine for her, but that's what started my journey. And 2 days ago, I lost a dear friend of mine, and I'm proud to be here. She died from breast cancer, and she had been treated with chemotherapy and radiation and all. She never tried the cannabis till at the very end, but she would have been very proud because she was here last year, and she loved the paparazzi. So in her name, I celebrate this lecture for you guys today. So my journey about the endocannabinoid system is, in one word, I say life, balance, homeostasis. This system is a mere 600 million years old. It has evolved from the sea squirt to what we have in humans today. In 1964, Dr. Raphael Mechoulam in Israel first discovered THC as the psychoactive component and CBD as the non-psychoactive component, and CBNs to have about 1/10 of the psychoactive component. The Israelis and Jews have always been ahead of the time. And in this program, every Jew had had PTS. And I can relate to PTS with my own illnesses. What I understand was that at that point, years later, this man later found the first endocannabinoid, known as anandamide. And I love this story. He said in the Hebrew language he couldn't find a word for joy. There was plenty of words for sorrow, but not for joy. I think the closest thing was nukas. Nukasamine didn't sound right. So they went to the Sanskrit language and they found the word ananda, joy or bliss. We also found out that there was receptors. The first one identified was CB1, primarily in the brain. A few years later, we discovered a second one known as CB2, primarily in the immune system. These receptors are throughout our body. That's why it works for so many ailments. It's not snake oil. What we learned also was that with the receptors, when you hear about dopamine and serotonin, these are made in the presynaptic, they're released, and they bind to receptors on the post. Our endocannabinoid receptors, or cannabinoid receptors, are not on the post. They're on the pre. So it's a retrograde. It's a balanced system. Dr. Damasio explains this system in 5 beautiful words: to relax, eat, sleep, forget, and protect. This is my mantra now. Relax, eat, sleep, forget, and protect. This balance, too much or too little of these 5 words, we are in balance. So let's start with relax. If one's muscle was constantly in a spasm or flaccid, imbalance. If we ate too much or not enough. If we slept too much or not enough. If we forgot too much or not enough. People say, why would you want to forget? So just as much as Alzheimer's and dementia is too much forgetting, PTS, if somebody remembered an event over and over, I always say this about childbirth. If a woman remembered childbirth, do you think you'd ever have sex again? Right? Men wouldn't be getting laid. So that's another conversation. Protection. Too much or too little. Overprotection. Autoimmune, rheumatoid arthritis. If our body can't protect, immunocompromised. So these 5 words are balance. We also learn that this system, when it doesn't work properly, we learn now about an endocannabinoid deficiency. Okay? This makes a lot of sense to me. If we think of a deficiency, it's not that you're an addict, you're replacing something you need. So we've learned too little of your endocannabinoids, anandamide, when we realize that migraines, fibromyalgia, MS, all of these different illnesses, IBS, are related to a deficiency. What I truly understand is that I did not know about this system, and to this day, less than 15% of the medical schools still teach it. How could we do that? There should be blood on people's hands when we don't let healthcare providers know about a system that's about life, and it's still not known. So go out and ask your healthcare providers, what do you know about the endocannabinoid system? I want people to know 5 things here. Cannabis has killed nobody, 0 deaths. We're facing an opioid epidemic, 47,000. This is an option. As I say, cannabis is not for everybody, but it should be a first-line option, not the last resort, okay? Truly. Your disease doesn't go away because you cross a state line. Why are we having separation for this medicine to be allowed throughout the nation? Number 2, the US government has a patent for this medicine and has had it since 2003 as an antioxidant and neuroprotectant. They've had the patent and several others. Number 3, this was prescribed by doctors. Today, I do not get to prescribe this medicine. I only get to recommend it because it's in Schedule 1 along with heroin, LSD, and ecstasy. Unacceptable, folks. Should not be. I'm fighting for it to be descheduled, not rescheduled. And that's a big difference, folks. If it gets rescheduled, it will be in the hands of pharmacy. The other thing I want you to understand is that we need this to be available for everybody. We need a specialty for doctors to know about endocannabinoid medicine. We need labeling. We need standardizations that can happen. And we want to see a dial. 2 types of stains that I want to just talk about, sativas and indica. Most things are a hybrid. Sativas, I think of sunshine. When does the sun shine? Usually in the daytime. Indica, I think of insomnia, nighttime use, but most things, see how it works. Delivery systems, you can inhale it, you can ingest it, you can put it in yourself topically or other ways. Suppositories that are being used rectally, vaginally, whole lot of delivery systems. Inhalation, I just want to leave you guys with, just as I said, it was counterintuitive. Inhalation is a very rapid method. Smoking is a very good method, and vaporization. Just as the content, people always ask, what about smoking and lung cancer? A study was done that looked at 4 groups. People that did nothing, smoked nothing, people that smoked tobacco, people that smoked cannabis, and people that did both. The group that smoked cannabis had the least amount of lung cancers, less than the people that smoked nothing. You think it could be preventative. The other thing is that the groups between smoking and tobacco and smoking, people that use cannabis had less cancer than the people that use tobacco alone. I want you people to understand the importance of stigma. We started out this morning about saying, I am. I am getting involved. I'm here informing you guys. Get involved, get the information, be proactive about your life. And as Fran said, remember what you put in you. Hemp, cannabis was in this country as food, fuel, fiber, paper, and medicine. We replaced it with the Hertz, DuPont, Rockefeller, Carnegie, Mellon, and one badass mouthpiece that was Harry Anslinger. So let's all get the information. I want to leave you with my words. Cannabis is not an entrance drug. It's an exit drug from pharmaceuticals and narcotics. God bless. Thank you.